Hey guys, what's up? So there's a couple of things that I wanted to go over with y'all regarding your exams next week and how we're gonna do things. So, your exam is just gonna be your chapter 4 test, right? So we're working on chapter 4 right now, and so your exam is just gonna be your chapter 4 test, and it will count as a test grade. What I'm gonna do is I'm going to put it up on Edge Elastic like I normally do. Exams are Wednesday and Thursday next week. So what I'm gonna do for Health Occupations is I'm gonna upload the test where it'll, you'll have access to it starting at 8 o'clock Wednesday morning, next Wednesday, right? So 8 o'clock Wednesday morning, it'll open up where you can get on Edge Elastic and you can take the Unit 4 test, which is your exam. You'll have from 8 o'clock Wednesday morning until 11 p.m. Thursday night, okay, to take the exam or test, chapter 4 test, okay? So 8 o'clock Wednesday morning is when it'll come up. You can take it anytime during the day on Wednesday, anytime during the day on Thursday. You just have till 11 o'clock Thursday night to take it. If you do not take it Thursday night, then you've got a 0. So make sure you're keeping track of that. And I think most of your teachers are doing this sort of thing, right? So 8 o'clock Wednesday morning till 11 o'clock Thursday night, you'll have that window. So it's 2 days basically to take your test.
Danny Montgomery, report to the front office. Danny Montgomery.
That being said, there are some things in chapter 4 that are not necessarily in the notes. So you know how I've been posting my videos of the notes in my voice and me going over the notes. There's some things that were in there that I forgot to mention that you need to be aware of. So just kind of wanted to run through those real quick. One of them is how long it takes for somebody to form a first impression of you. So we talked about how you should maintain a level as a healthcare worker. You should maintain a positive self-image and a level of confidence. You should carry yourself confidently and positively, because that conveys to the patient that you know what you're doing and you're going to help take care of them, right? It takes 20 seconds to 4 minutes for somebody to form a first opinion of you. I think I did mention that in the notes, but I want to make sure you know that is going to pop up on your test. Okay, so 20 seconds to 4 minutes is how long it takes somebody to form a first impression of you. Another thing that we wanted to go over is make sure you look over your notes for your exam or your test. About on the front page, I believe it had like diet, sleep, exercise, and like tobacco and drug use. As far as sleep goes, remember, not everybody needs the same amount of sleep. So where it says like everybody needs 8 hours of sleep, that's not correct. Everybody needs a different amount of sleep, okay? As far as tobacco and drug use, just make sure you know what tobacco affects. Hint, hint, it doesn't really affect the urinary system, okay? Does it affect your lungs, your circulatory system, and things like that? Yes. Urinary system, not as much. What else? It mentions about personal characteristics. Now, personal characteristics are all those kind of, I'll call them vocab words, like empathy, tact, discretion, honesty, responsibility. All those are on the exam or test, right? You have to know those. That's why I gave you that Quizlet quiz today, and it's a good way to practice, so you have to know those. But it mentions something about a person's personal characteristics are part of their personality, and it's impossible to change those. That would be a false statement. That's basically saying like Bob, and I keep using the name Bob, but Bob is, not dependable, and he's, never going to learn to be dependable, and I can't change that. That's not true. That's a personal characteristic, dependability, but you can change that. People can change, okay? So where it says like personal characteristics are part of somebody's personality and you can't change that, that's not true. Same thing with Bob, not being self-motivated or something like that. He's not self-motivated and he can never change that. That's not true. He can change. Okay, so it's something to keep in mind. Name badges, you have to wear at most places where you work require you to wear name badges. Got mine right here. Specifically in the medical field, they require you to wear name badges. And you have to know, like at a long-term care facility, by law, you have to wear a name badge, okay? As far as shoes go, nothing too tricky there. Just remember, ideally, they want you to wear white shoes. Now, you see people in the hospital all the time. The book's a little outdated. You see people all the time in the hospital or, doctor's offices that are healthcare workers that don't have on white shoes. But for testing purposes, the book tells you white shoes. How often do you clean them? Not once a week, not once a month, but daily. Daily, you clean your shoes. There is a question as far as jewelry. You know about jewelry. Rings, watches are okay. No hoop earrings, no long necklaces. There's a question where it says something to the effect of, you know, some places you don't have to wear scrubs. You don't have to have a uniform at some places where you work if you're working in the medical field. And it says just because you don't have to wear a uniform, you can wear whatever jewelry you want. That's not true. Even if your place where you work, maybe a doctor's office, that doesn't require you to wear a specific uniform or scrubs, but you still have to abide by the jewelry rule. Just because they don't make you wear a certain uniform doesn't mean you can wear whatever jewelry you want. Okay, so just something to keep in mind. Every patient's entitled to confidential care. Okay, no matter what the patient, they're always entitled to confidential care. I mentioned in today's video with the notes, you do not own your medical records. The hospitals and doctor's offices own your medical records, but you do have a right to have a copy of them. And you have a right to limit who can see them. When you're communicating with patients, this is not in the notes, and you need to know this. And it's something that you probably kind of realize. If you go to the doctor and they're using all these big words and stuff like that, and maybe your mom and dad are there or somebody's there with you, if they're using big words and stuff like that, do you tend to stop the medical person and say, hold up, I don't know what you're talking about? No. So when you're because you don't want to feel stupid, and that's literally what the book says, you don't want to feel dumb or stupid. So whenever the doctors are using big words to communicate with you, you usually don't raise your hand and stop them because you don't want to appear dumb. So they say if you're the healthcare worker and you're communicating with your patient, you need to use words that the patient understands, because they're not going to stop you because they don't want to appear like they don't know what they're talking about. So if you're the healthcare worker, when you're talking to your patients and communicating with them, use simple words that they will understand, that the patient's going to understand. If you don't, they're not going to stop you, and they'll just, they won't have no clue what you're talking about because they don't want to appear dumb, okay? So it's something to keep in mind. If you make it, and I'll keep looking over here, he's got my little paper. I want to make sure that I tell you everything that I need to tell you. If you make a mistake in a patient's chart, and I mentioned that in the video, you cannot use whiteout. Sometimes I'll say correctional fluid. Correctional fluid is the same thing as whiteout. Sometimes you see whiteout that's like the tape whiteout, and then they got what they call correctional fluid is like the liquid whiteout. You cannot use whiteout in a patient's chart. You typically write in pen in a patient's chart, and you have to put one line through it, put your initials, and then write the correct statement. So if you write, Bob has a blood pressure of 150/80, and then you're like, uh-oh, I didn't write the right thing, that's a mistake. Can't white it out, can't use correctional fluid, put a line through it, initial it, and then fix whatever it is you need to fix. Because medical charts are a legal document, and they can be admissible in court, and they need to be able to see what you wrote originally. That's why you can't use whiteout or correctional fluid or like erase and pencil and stuff. You always have to use pen. I'm trying to think if that's anything. Can your nonverbal response disagree with your verbal response? Just make sure that yes, they can disagree. Is it good that they disagree? No, it's better in the communication process if they match. What does that mean? That means you got a patient and you're prepping them for surgery, and you ask her if she's, nervous at all. Is she okay? The patient's like, no, I'm not nervous at all. I'm fine. Cool as a cucumber. I'm good to go. And then you look over and their blood pressure's sky high, they're sweating, so their nonverbal stuff is totally disagreeing with what's coming out of her mouth, because she's saying that she's not nervous, but her numbers and everything show that she is nervous. So the verbal and nonverbal message can disagree. It's better in the communication process if they match. So then you may want to go over to the patient and say, are you sure you're not nervous? Your numbers are a little high. I think you may be nervous, and help the patient, okay? I'm looking to see. Let me flip through this real quick. Let's see if we're forgetting anything. As far as that stuff goes, you don't want to put any bows or butterflies or anything crazy in your hair. It's just a ponytail. Make sure you know your personal characteristics. Like I said, that's all on that Quizlet. All those words, you're going to need to know those. The definition of communication, which we went over before. What else do we have on here? Do listening skills need constant practice? Yes, we went over that. Aphasia. Make sure you know your three types of communication barriers. Remember with aphasia, they know what they want to say, they just had trouble getting it out. So it's not that they can't talk, it's a speech impairment. Make sure you have patience with them and allow them time, and maybe some writing materials to write out what they're trying to say. Another physical disability is blindness and deaf, and somebody being deaf, your patient being deaf. That's totally a communication barrier. It's going to affect how you communicate with them back and forth. It's a physical disability. Psychological barriers, remember prejudice, attitudes, and personality. Constant criticism, negative attitude, that's all a psychological barrier, and that's going to affect how you communicate with your patient. cultural differences, belief that illness comes from God, language differences, eye contact, all that's all cultural. People come from different backgrounds and you have to respect that, okay? I think that was everything. I'm going to make another video in a little bit that kind of wraps up the chapter. We have teamwork in this chapter, leadership, and managing your stress and goals. And so I'm going to make a little video going over that with the notes. And then I'll make another video kind of like this one because I feel like sometimes you guys need to see me. So you'll get a bunch of videos from me. Just make sure you're watching them because they're guaranteed to help you out. But anyway, I will probably post a study guide of some sort on Monday or Tuesday to get you ready for Wednesday's test or exam, okay? If you have any questions, let me know. I hope you guys have a fabulous weekend, and I cannot wait to see you guys in about a week or so.